Now, more than 14,000 women in the United States are diagnosed with invasive cervical cancer each year. However, the disease is preventable with vaccination and appropriate screening. Here now to share more information is the Gynecologic Oncologist at Montefiore Einstein Cancer Center, Dr. Nicole Nevadunsky. And thank you so much for being with us.
Thank you so much for having me here today. Cervical cancer is a leading cause of cancer worldwide and a leading cause of cancer deaths for women. The cervix is located inside a woman's body. This is the part when a woman has a baby that dilates to 10 centimeters. But women can't observe and make sure that their cervixes are healthy and safe by themselves. They need their doctors or their nurses or healthcare providers to perform screening.
So when we talk about these screenings, it's very important for these screenings to take place. But how often should a person be screened?
That's a great question because sometimes the recommendations change. But as of right now, a woman at normal risk for cervical cancer should be screened with something called a pap smear, which her GYN doctor does in the office once every 3 years. Again, so that's a pap smear once every 3 years. There's also a new form of screening called HPV testing, human papillomavirus testing, and that can be performed once every 5 years. Some women even have both testing together at the same visit.
Talk to people about signs and symptoms because this is very important, right? I think we talked about how often you should be screened, but I think it's more important too that people know exactly about signs and symptoms. Are they commonly visible? What can you tell us?
So for early cervical cancer, there are no signs and symptoms. That's why it's so important for a woman to go to her gynecologist annually and to have that testing like we talked about at least every 3 years. When cervix cancer has grown and spread, symptoms can include bleeding that happens when a woman is not supposed to have her normal monthly menstrual bleeding. It can also cause bleeding after sexual intercourse. When cancers have spread a lot, a woman might experience pelvic pain or discharge, and it's very important that she see her GYN doctor or her family doctor as soon as possible.
Give me a little insight here because once a person is diagnosed, obviously that's a very traumatizing time for some. After a diagnosis, how do you guide that patient and navigate them through after they've gotten the news?
Well, early cervical cancer is almost 100% curable. The ways that we treat early cervical cancer usually involve surgery, and it hopefully can just be surgery and not need any other treatments. For patients who come with advanced cervical cancers, their treatment usually includes chemotherapy, which is an infusion, and or radiation therapy. What is exciting is that scientific research has provided us other tools to treat cervical cancer, like immunotherapies and targeted therapies.
And as we talk about treatments, it's very important that a person is treated. How long is that treatment process? We talked a little bit about what it entails. How long does that treatment process go for?
Well, if someone has an early cervical cancer and has a surgery, hopefully she's having a surgery and recovering within a 6-week time period. If someone needs to have radiation or chemotherapy, that process can take several months. But I think what's really important and what's really important for Cervical Cancer Awareness Month is to think about ways that we can prevent to getting to that point. And I know we mentioned screening. There's also a highly effective preventative measure.
So go ahead and take it away. You said how you got us to the edge now. You got to take us there.
Are the way that we can prevent cervical cancer. Vaccinations happen when children are 11 to 13 years old. It's 3 doses, and women are eligible for vaccinations up to the age of 26. In certain situations, patients beyond the age of 26 can even have vaccinations against cervical cancer. In countries where people have taken vaccinations for cervical cancer, meaning over 70% of the population has been vaccinated, they have already seen drops of over 25% in rates of precancers and cancerous cells. And some of those countries believe that they will be able to completely eradicate cervical cancer. But it's really important to get those vaccinations.
Yeah. Dr. Nicole, talk to me about what you see coming through your doors right now. When the conversations had about cervical cancer, is it something that a lot of women are speaking about, or is it a conversation that you have to introduce in order to make people more aware?
Well, I think with lots of issues that deal with women, there's a taboo, and people don't want to talk about irregular menstruation or bleeding after intercourse. And sometimes they feel embarrassed or they feel that somehow they caused this to happen to them. So hopefully they're finding their way to their doctor's office or into my office. One of the things I think we're really struggling with is from the pandemic that women did not go for their annual GYN exam or their pap testing. And so I've seen a lot of patients when they've had an abnormal pap result, really blaming themselves and saying, hey, I didn't come, I should have come, and really feeling guilty about that. I think we all understand that the past 3 years have been incredibly hard for everyone. And I really encourage women, it's not too late. Come in, get your pap test. If you're already having one of those symptoms that we also talked about, come in sooner than later because there are very effective treatments.
Yeah. And so for people who want more information, what exactly do they do? How do they tap in?
So the best way to get connected to a provider is to contact your family doctor or your gynecologist. There are many good providers at the Montefiore healthcare system where I work, but at other healthcare systems as well. If you want additional information about cervix cancer and treatments in general, I think that the American Cancer Society has an excellent wealth of information that is vetted and true and helpful and written in a way that people can really understand it.
Yeah. And before we go, I want to get an opportunity to talk a little bit about the risk factors because that's very huge, right? And what are the risk factors that are involved in this?
So we think that almost all cervical cancers are caused by the HPV virus. Now, the HPV virus is very common. It is a sexually transmitted disease, but over 60% of people in the United States of America who have ever had intercourse will be infected with HPV. HPV does not cause cancer for all of these patients. However, if it's persistent, then these cancers can develop. So, multiple lifetime sexual partners, early start of sexual intercourse. These are main risk factors for cervical cancer. Also, some patients have factors that they can't control, like immunocompromise, an HIV infection or a problem with an immunologic disease like rheumatoid arthritis, where they have to take certain medications, really is a big risk factor. The other thing that is an absolutely modifiable, meaning changeable risk factor is smoking. So if women are able to stop smoking, their bodies are more able to clear the HPV virus and stop cervix cancer before it even starts.
Dr. Nicole Nevadunsky, thank you so much for being with us, talking about cervical cancer and Cervical Health Awareness Month. Thank you. I think a lot of information we'll be able to dispense, and hopefully people will take advantage of it. Thanks again for joining us.
Thank you for having me today.
All righty. For more information, you can visit cancer.montefioreeinstein.org. Then follow them on social media at Montefiore NYC. We're encouraging you, don't go anywhere. We'll be back more open right after this.